My name is Dr. Siyana Mahroof-Shaffi. I would love to tell you about the story of how we developed Kitrinos Healthcare. It's a small project that is providing healthcare services in Greek refugee camps, currently in the camp of Moria in Lesvos. I am Sri Lankan born, been working in Britain as a medical practitioner, GP, for nearly about 25 years. I consider myself now a humanitarian medical doctor. 4 years ago I was privileged to be able to go as a humanitarian doctor leading a medical mission to the small island of Lesvos in Greece, where there was a small crisis emerging. When I had the ability to run one of my women's health clinics, so I consider myself a women's health practitioner as a woman doctor, one of the privileges was the conversations that I was able to have with the women in privacy. And I remember one woman in particular saying to me, she came in with something really basic, it was just a rash. But actually, when we were in that closed space together, she opened up to me that they left Syria because her children's journey to school in the morning on a school run, which I do with my children, was that they would have to navigate a street, sometimes with heads rolling around. So there were beheadings happening a lot in Syria. And she didn't want this for her children. She didn't want her children to have to see that on their way to school and on their way back. You know, it's like a scene from an apocalypse, from a horror film. We don't even let our children watch that on a film. Why would you allow your child to go through and see that? So she said that's why they left, otherwise they had a good life. You know, they had a good life. It was a civilized society, and the war destroyed it. In our clinic, our patients are quite privileged to have a facilitated consultation. So we do primary healthcare as our main role. That's the reason we're there. But as humans, ultimately, that's never enough. So we have to do a little bit more. Sometimes we provide if we notice that someone perhaps isn't eating very well, we can supplement their food and their nutrition. We can provide for breastfeeding mothers and babies in particular. We also have been known to go that extra mile and get extra blankets if we notice that someone is exposed and doesn't have proper clothing. You'll see feet with no socks on them, we'll get some socks on them. So we have to keep the little extras around us. One of the key and pioneering services that we've offered in our clinics that isn't offered in any other clinic, in any of the other clinics in the entire Greece that I know of, is that we offer physical treatment as well as psychological support in the same place. So as people enter, if they're noticed to be quite distressed, we actually are able to perform a technique which is called TTT, trauma tapping technique, that is a proven technique to bring about relief for stressed individuals. We can do it on site. There's no waiting list. We even use lavender oil to bring calmness. So if anybody goes on our website and downloads the reports, they'll be able to read more about the TTT technique, which doesn't actually have to be used just in refugee camps. It works for anybody who's traumatized and stressed. One of my greatest pleasures is to have the privilege of such a wonderful team working with me. From the moment a person comes to the clinic, I think everyone knows that they are to treat this person with kindness and respect. And certainly from the interpreters, from the clinicians who come to us. One of the things I do with my team and my doctors and nurses when we're selecting them is we actually put them through a very rigorous vetting process. We get from them copies of their degree which are certified. We get the DBS certificate, a certificate to prove that they don't have a criminal record. And I've been accused of asking for more paperwork than even MSF, a big organization. But I'm very proud of that actually, I'm doing my due diligence. And I think one of the best things about our team is that we don't cut corners. What you see is what you get, and everybody gets the same. There is no privileges given to one person or another. Everybody, regardless of their sex, the country they come from, everybody gets the same and the best possible treatment. So the care that I like to give in our clinics is the same that I would give in my UK clinics to my UK patients. And again, I've been accused of perhaps going a bit over the top here, but I will not cut corners, not just because I'm in a refugee camp. I have about just over 1,000 now registered clinicians who come regularly. I think it's been really heartening for me to see some come over and over again. One or two have actually been there now for over a year, and one of them is Dr. Tomas from Slovakia. He gave up a very well-paid job in the Czech Republic. He was on the career ladder to become an A&E consultant, which is what he wants to be. And he came to me in January 2018, he started working with me, and I actually wanted to employ him at that time. When we got to about March, my funding situation was pretty critical, and we had to write emergency letters to all our staff, and Tomas was one of them, and I had to write a letter to say, I'm really sorry, but I actually don't think I'll be able to pay you going forward. And of course, he was then at the liberty to go wherever he wanted, to go back to Slovakia. He turned around and he said to me, Siyana, I came here on a mission to help you and to help the people, and I will manage. And he stayed, and he continues to stay.
So my name is Tomas. I'm from Slovakia, and I'm working with the Kitrinos since February 2018 as a humanitarian doctor. And I've been here in Moria since middle of the summer, like end of the July I came here. It's actually we provide like a kind of primary healthcare in the refugee camp with like a circumstances what you can see around and in the facility or equipment what is available. So it's not a typical primary healthcare facility what you can see in a hospital, not in a hospital, in other conditions. So it's kind of improvising, and basically we are focusing on the people who are based in the camp, which are more than like 8,000 people who are coming with the acute disease, or we also provide like a management of a chronic disease. Because the Kitrinos Healthcare is like a quite long-term good experience with this kind of healthcare. And also doctors are more trained for this situation, because we know that this is something what we cannot learn in the schools or in other hospitals. This is something what doctors need to have experience. So Kitrinos Healthcare can provide these doctors who can aim or the focus. They are not naive and they are more practical doctors. So it means they are able to solve the problems at the point where we are. We don't have to be dependent on the hospital, because we know that hospital system is overwhelmed, overload. So, and instead of waiting patients a long time for appointment, specific appointment, we can already start to do something here from this point. And then also, because of our long-term staff, for example, like our coordinators, our translators, so people already know us and they have they trust us. We know that mostly these NGOs are based on volunteers who are changing after some time. who just come in for a short term. They are not available from the hospitals. I used to do it like that, but now let's say I'm a little bit longer here. So I know if anybody would like to do their best, still the biggest benefit is because we have this long-term stuff and people already know us, and it's also better, easier to keep a continuity and trust and like that. For myself, I can see that, like, let's say from profession, I would do something like this in the future at the same position, like for example, like Dr. Siyana. She's the director of an NGO who provide this kind of healthcare. So as a caregiver, as a doctor, something like that in professional life, until I will obtain a sufficient experience, education, all these things, because I still consider myself as a junior doctor, even if I have some years of experience. What I wish for myself, or what I was able to do, I wish also for them, whatever it is. And mostly we are talking about like education, having a good job. I had that luck that I could choose my job, and just these basics. And I don't think that people, they don't expect anything more. Just being like calm, safety, sometimes dry place because when it's raining, and then slowly, because we know it's not get easy, but very basic things. I cannot say what I wish for them, but I wish for them like something like. But I can see that all of us, we have the same dream, and we don't expect like so much from our life, just the basic.
A lot of young doctors who come to work for us, Palba, Roselle, they helped me immensely in the clinic, especially with the gentleman who was unconscious. I think it's very refreshing for them, because working in the NHS like I used to, it has its own challenges. We are becoming very bureaucratic and very defensive in our practice, so we do things which our managers ask us to do and the government asks us to do, but doesn't necessarily improve patient care. And what's really nice about being in such a basic facilities again is the doctor-patient relationship blossoms. We can actually suddenly become the people that we were trained to be, the caring individuals, the ones who you know, want to give and want to make people happy and better.
I'm Raisa. I'm a junior doctor from London, and I've been here for 2.5 weeks. We just see any patients who come on the day. Most of them are the type of problems that someone would go and see their GP about at home, or maybe go to A&E about. We have some basic medications. We can do some basic procedures like suturing if people have wounds, and the nurse is very good at wound care here. And sometimes we can refer things to the hospital, but we have to be quite careful about what we can and can't refer, but sometimes we do that as well. And obviously if it's an emergency, then we would send them to the A&E department in Mytilene. I think it's very important because they really don't have access to healthcare, and they have a lot of problems because most of them have been on very long journeys, and in their home countries often been, or on that journey being exposed to very dangerous things. So they have a lot of health problems. So it's a population that have increased needs and then don't have any access. So it's quite a satisfying job to be here. I enjoy being in the clinic, and it's really good because there's interpreters, and often you feel like you can help people, but usually with quite basic things. But equally it can be frustrating because there's lots that you can't do for them that you feel, and there are a lot of people suffering a lot, and we can't always give them the help that they need, but sometimes we can, so that's good. It would be completely impossible. I've seen maybe less than one patient a day that can speak good enough English to be able to tell me what's wrong with them, so we wouldn't be any use here unless we had interpreters, really. So there was a lady who came in and she'd been raped about a week before, and she had been given medication for preventing HIV, and she'd taken an overdose of the HIV medication and was unconscious by the time she got here. So that was really sad. We did the very basics here, but she needed to go straight to the A&E department, so we just called an ambulance straight away. A lot of the day is spent dealing with mental health problems, which is very sad. And we have very limited resources to deal with that, which is really hard because people are really suffering, especially with PTSD and depression, and we are not allowed to prescribe any psychiatric medications, which is understandable because some of them are quite dangerous and they have a black market value, and also if there's a risk someone would commit suicide, they can also be drugs that people could overdose on, and so it needs to be in an environment where you can monitor people, which isn't necessarily what you can do here. So there are good reasons for that, but it's very difficult to see lots of people suffering, and there's very little you can do. There's some psychological support available as well, and there are some, we can refer some patients to psychiatrists, but there's not nearly enough available. So I think that's one of the nicest things about working here. I feel like I've made friends with people from all over the world, and I think it helps you to realise when your colleagues are also refugees, everybody's exactly the same, and also a bit more of an understanding about what it would actually be like to live in Moria, and just all the other issues about being a refugee and that your entire life is never going to be the same again, I guess. It would be ideal if everybody in the camp could have medical treatment just like anybody else in Europe does, and I don't think people get that.
In our clinic, one of the advantages is that we do have access to some few tests like blood tests and x-rays and even an ultrasound. We have an ultrasound machine in the clinic, and these young doctors are sometimes quite pleased that they can actually put practical skills into use at the point of care. This is not something that always happens. As we know, in our part of the world, we have to be referred, we have to wait for a few weeks or months sometimes for an appointment, and then someone does it, then that person has to write a report, and that report comes back. No, here we have it at source. So actually, whoever said that in my clinic I provide sometimes better care than the NHS, perhaps they could be right. In the refugee camps, what is becoming apparent is the high rates of psychological illnesses. And of course, people, despite having hope when they first arrive, if they have been there for months, and in some cases years, up to 2 years before a decision is made about what happens to them, it can wear them down. And when a grown man, during Ramadan of 2018, when a grown man was found hanging from a tree next to the masjid in the camp, next to the mosque in the camp, and he was rushed in, and the rope was still on his neck, and he had the marks on his neck, and he was really struggling to breathe, and he was about to take his life in a holy month. It really is saying something. And we often see this now, where some of the biggest emergencies in our clinics are these situations where people get brought in collapsed. Young men in particular, they get very deprioritized, shall we say, because obviously we should prioritize women and children and the elderly, and therefore, naturally, the young men become like the bottom of the ladder in terms of needs and what's good for them. And so when this young man comes in, collapsed, he was found collapsed outside a tent. He'd been sick, and he was really, really cold. We wondered if, perhaps he'd taken an overdose of something, And then a few months later, we actually found out that a young man was found dead in the camp. And it does make me wonder, you know, what conditions they're living in. With the refugees, I always put myself in their situation because I can see that, you know, quite easily. My own father left our small island of Sri Lanka because he wanted a better life for us, his children. And that's what I want for them. I think everybody deserves a chance in life. You know, the world isn't, we were not all born in one place. We have all ended up where we have ended up, but coming from so many different backgrounds. And who are we to judge or say that these people must now stay where they are? It's very haughty, and it makes me angry that we can't put ourselves in their shoes or see how we used to be. I mean, even in Britain, you know, just at the turn of the century, there was a big war. And our Queen, who presides over us now, will remember the hard times when children were left on platforms of trains, stations, to be picked up by complete strangers in order to survive. We're humans, we deserve to survive. That's our right.